Opinions expressed on this show by Dr. Del Campo are solely her own. Her opinions should not be taken as medical advice. It is strongly recommended you consult with your own doctor before undergoing any cosmetic or dermatological treatments.
Welcome to Derm Talk by Dr. Roberta. I'm Dr. Roberta Del Campo.
I am Henry Del Campo.
And today we're going to be discussing injectables, including neuromodulators and fillers.
This is going to be fun. This is probably one of my favorite, I think, episodes. So anyway, I think to kick things off, injectables. You got, of course, I think everyone knows Botox, right? Which is effectively, brand name for a neurotoxin. And then we have fillers, which, there's a lot of science and a lot of chemistry behind both. But I think maybe we should start off with the topic of neurotoxins, right? It's something that I think a lot of people, especially here in the South Florida market, a lot of providers will say, hey, look, it's relatively simple to administer. I think there's a lot of debate around that. You see a lot of folks when you see them on the street, you're like, whoa, that job was not that.
Well, you can tell they have a neuromodulator, and the key is to not notice, just that they look refreshed.
Exactly. So you'll see a lot of bad work out there, especially in certain markets. I think you definitely see it. So would love to get your perspective of your approach, right? Male versus female. Why it's not necessarily that easy. And by the way, I've seen a lot of your work, and of course I'm biased, but yeah, I think you are a tremendous injector. But it's not that easy, right? So love to get your view, the doctor's view in terms of, okay, Botox, neurotoxins, how you approach and why you're so successful at it.
So I think, interestingly, the idea of trends in dermatology and injectables, specifically neuromodulators, go hand in hand, because one of the trends is really to inject in a natural way, to not change somebody's face, to not just treat lines, but we're using these injectables to enhance the appearance of someone by opening up their eyes, by lifting their jawline, by tightening their neck. But it's not really just about lines anymore. Before we used to freeze the forehead, which made people look a little bit weird at times. Now we like a little bit of movement in the eyebrows, like I have, so that it looks natural and you still have natural expression. What people don't know with neuromodulators, and I kind of giggle when I have patients that come in and they say, I know it's so easy to inject. How are people messing this up? Because they'll comment about, I saw this person, that person, they look crazy. Isn't it an easy treatment to do? It is easy if you're an expert, meaning I've been doing this now for 11 years and I have really found my niche in terms of how I inject to keep someone looking natural, and it becomes easier for me because I really understand the anatomy. But what I think it comes down to is everyone thinks they can just pick up a syringe and they can just inject in the areas that say to inject in the textbook. But we know now that anatomy is different for everyone. For example, thinking about comparing it to medications. Some people metabolize a certain pill faster. Somebody else, metabolizes a certain ingredient faster. It's the same idea with an injectable where the muscles can be slightly different, even though we have the frontalis muscle, the forehead muscle. Somebody might have a wide frontalis. Somebody else might have a shorter or smaller frontalis. Somebody might have accessory muscles that are pulling. So you have to really be able to look at the person, have them move and animate, take the time to assess that patient's anatomy, and then eject accordingly. I've seen where a lot of providers mark everyone exactly the same way. I'm going to put 4 units, 4 units, 4 units. Well, I walk in the room, I spend a few minutes talking to my patient. I see how they naturally animate and move. They don't know I'm really assessing them at that point as we're talking and chatting, but I assess how their muscles move, and then I make a game plan and I alter my treatment plan based on what I see. So it's a very personalized type of treatment. I think it's also important to understand that you have to talk to the patient and understand what they're looking for, because someone may want a very light treatment, somebody else wants a more heavy treatment, somebody wants eye movement, eyebrow movement, someone else doesn't. And I think as injectors, when you get into a routine of really speaking to the patient, getting to understand what they're looking for, you can give them the best treatment.
Yeah.
It's very common. People now, they rush. They get in, they're like, I'm going to do Botox in 2 minutes and I'm out the door.
Yeah.
You know, my Botox, as you mentioned, my neuromodulator, I should say, treatments are a good 15 to 20 minute appointment, because it's not, the injection takes me 2 minutes to do, but it's assessing the patient. It's discussing what they're looking for. It's me marking them before I inject, and really understanding, you know, what the results they can expect.
Yeah. So you really have to understand their movements, their muscle structure, all that's important.
Absolutely. And everyone's different. And I think that's where actually new studies are coming out. You know that I love to read journals and understand what's going on in the world of aesthetics. And there's more and more data coming out that the glabella has different shapes for everyone. The frontalis muscle, the periorbital, muscle might be a little bit wider or smaller. So you really can almost try to look under the skin as a very educated provider by watching their muscle movement and marking them accordingly.
I know that you take an approach with other areas as well.
Mm-hmm.
You'll take a look if it's a right candidate platysmal band.
Yes.
You may do some stuff around maybe the
lower face,
the lower
around
face.
the mouth.
Talk a little bit about that.
So even if a patient comes in my office and they say they want, the 11s treated, which is the glabella between the brows, I always do a formal consultation assessment. I give them my thoughts and my recommendations, because they may just not be knowledgeable that you can treat the lower face, that you can contour the jawline, that you can tighten the neck, that you can give a lip flip. Neuromodulators now have become a way to use artistic steps, right? To really contour and change the face. Again, we're moving away from just lines. And when you think about the lower face, we all want a lifted appearance. A youthful look to the face is actually an inverted triangle, right? So you want to be a little bit wider up top and a little more narrow on the bottom. As we age, we become more square or more round. Yep. So we can use neuromodulators to relax those muscles and actually lift the lower face. We can also use it as a preventative technique. Over time, somebody has very thick, strong platysmal bands, and they use them often. They will break and they will split, and it will make the neck become wider. We call it a turkey neck. And that's where using neuromodulators early, especially for someone who's genetically inclined, you can actually thin those platysmal bands so that you don't have that turkey neck as you age. So it can be used as a corrective technique and as a preventative technique.
Yeah. What's a good candidate for, say, lower face neuromodulator?
Someone who has a downturned smile. So, I have patients who come in, they say, it just looks sad,
Yeah,
and commonly it's because the corner of the mouth, the muscles strengthen over time and it pulls the corner of the mouth down. That also gives us basically these little jowls, look kind of chipmunky, and that's because of muscle movement. So you can inject small doses of neuromodulators in the corner of the mouth to lift, to make somebody look happier and to actually contour the jawline by minimizing those jowls.
Let's switch gears a little bit. Fillers. This is an area that I think you certainly excel in.
This is where really, I think neuromodulators are art, but injectable fillers really are the true artistic side, because you have to think about shapes, about contouring, about projection. And, you can look at somebody one dimensionally and their cheeks look good. And then they turn to the side and they have this terrible projection, or lips are another primary example. So this is where understanding different angles, understanding projection versus volumization, understanding different products. Neuromodulators are easy because you have a few neuromodulators to choose from, but they all essentially work the same. It's really a ejectable preference. When it comes to injectable fillers, you have to think about how thick or thin, how flexible, how stiff, how water, soluble, how hydrophilic. There are a lot of different things that we have to think about, characteristics that are involved in choosing the right product for a particular client.
Yeah. So you're probably targeting a lot, I guess, the cheeks. You call it the smash, I believe.
The smash.
You're
That's
probably
one
doing
of my, yes.
Yeah, you're doing a fair amount of jaw lines, I presume. Chin as well, right? Yep. But I guess every individual is different.
Correct.
Right.
Yeah, and I think when I just will quickly kind of separate what fillers are used for. Sometimes we use them to volumize. So somebody wants a little more volume in the lips. Somebody needs a little more volume in the cheek because they're becoming a little more gaunt. Somebody who's becoming hollow under the eye. eyes. That's considered volumization.
Yeah.
Then we can use injectable fillers to actually lift and contour. So jawline enhancement, chin enhancement, nose enhancement, cheekbone enhancement. And those are different types of products. So we think about enhancement and contouring versus filling or volumizing.
Yeah, and I forgot about the lips.
It's a common area that I treat, but I will tell you, speaking of trends, that my trend in my office is really more about natural hydration, not over volumizing, not contouring too much. You know, I think before was really this heart-shaped lip that everyone wanted a really defined border. And now it's more just a softer type of appearance of the lip.
Yeah.
Hydration to smooth fine lines, to give a little bit of a pout, but not to overly volumize.
Yeah. So you'll get a new patient that comes in. Poor work has been done from a filler perspective, and
How do I approach that?
Well, no. What is the most common area that you see, whether it's cheeks, lips? I don't know.
Hands down, tear troughs, under eyes.
Oh, that's the worst.
That is because people will come in with blue bags under their eyes. I mean, it is horrible. And what's interesting is many of these patients come to see me because, oh, my pores are big. What can you do? And then I look at their under eyes and I kindly say, let's talk about your skin. Let's talk about some treatments. Oh, by the way, did you happen to have fillers in the past under your eyes? And they say, yeah, but it was years ago, or it was 6 months ago. And then I say, oh, well, you know, we can make it look a little bit more refreshed while we treat your skin. Let's think about this. And they say, what do you mean? And I explain to them they have the Tyndall effect. It's fillers that are either too high in the skin, too thick, and they give a blue appearance. So it actually leaves blue bags. And I tell them that I can fix it within about 30 seconds, and they're ecstatic. They're like, what do you mean you can fix it? And I just put something, I dissolve it, and it's gone. So that really changes their life, because some of them have been walking around for years, looking like they have bruised, full bags under their eyes.
So let's talk about a few trends relative to fillers. What are you seeing out there?
I would say the most common trend is less is more, and I love this. We've seen that a lot of celebrities and beauty editors are coming out speaking about people being overfilled, or even celebrities talking about having fillers that they've had dissolved. So I think the trend of natural enhancement, of really only filling in areas we actually need to have filled and not overdoing it, is a big one. I think also injectable fillers for rejuvenation of the skin. So it's an interesting topic, and I know in a future episode we're going to talk about regenerative medicine, regenerative aesthetics. This is where injectables such as Radiesse, which is a calcium hydroxyapatite ingredient to stimulate collagen and elastin, comes in. So it's about natural enhancement. It's about actually using them to improve contour, to improve skin quality. And I think the trend of, using these in combination with other treatments to allow less injectables is a big one as well.
Yeah.
So a lot of patients are coming in saying, I just want an overall recommendation, consultation. What do I need to make me look better?
Yeah.
And I say a sprinkle of, filler in the cheek, a sprinkle of filler in the chin. Let's do a touch of neuromodulator treatment in the upper face, lower face, and let's do some laser repair of your skin because your skin is dull, etc. And so when you combine those things, you actually have to do a little bit less of everything, and it offers a more natural result.
So I guess if you could talk to us a little bit about the science behind it, right? I think you alluded to it a little bit, but I guess for the audience, scientifically, how does the process take place?
So I think when we think of fillers, we have to separate into two different categories. One being hyaluronic acid fillers, which most people are knowledgeable about or have heard of because that's the most common type of injectable filler. Hyaluronic acid is a natural substance we have in our skin. It holds more water, 1,000 times its weight in water. And what that allows is specifically a little hydration of the skin, volumization of the skin, because it attracts water. So common areas that we use hyaluronic acid fillers are the under eye, the lips, the cheeks. And then we get into the other side of fillers, which we would consider more of the biostimulatory fillers. So we have Sculptra and Radiesse. Those are the two big ones. Sculptra is basically a product that we inject to make your body think there's a little wound under the skin. We have cells that come in, they engulf that product, and then they stimulate collagen around it. So it's basically a collagen builder. The other product, which is my personal favorite, as you know, is Radiesse. Radiesse works a little bit differently. It directly connects with our fibroblasts, which are cells in our skin that stimulate collagen, elastin. It stimulates angiogenesis, so it adds basically vascularity to the skin to improve skin health, proteoglycans, which hydrate the skin. So that's really giving an overall skin quality enhancement. But we can also use it as is rather than using it for biostimulation to contour because it looks and feels like bone. CAHA, or calcium hydroxyapatite, is like our bone. So I use that commonly, the cheekbones, the chin, the jawline, to give the appearance of bone, but it also lifts the skin. But I think the two main categories we think about really are these hyaluronic acid products and these non-hyaluronic acid products such as Radius and Sculptra.
Yeah, that's great. That's fantastic.
And there are probably more to come. I mean, every year I've seen, especially with hyaluronic acid, and one of my favorite products now, the product line RHA, it's a newer and the newest line of hyaluronic acid products. So we take an older product and we make it better. And how did they make it better? They made it more natural. They made it softer. It's more flexible. And so the reason I love this particular line of products is when it's used in the face, it can be used with movement and you don't see it. Some of these old products, when I trained when I was a fellow 10 years ago, you could feel it. It was like hard in the skin, or it would form lumps or bumps under the skin. These newer products are much more cosmetically elegant.
I've always wondered why do some folks really, when you've said in the past, like run through fillers quicker than others? And when I say run through it, effectively the body the body kind of just works through it, right? And then after, somebody could have a filler in there for a year, look fantastic. It hasn't moved, and then another person I wouldn't say 3 months, but maybe 6 months in, it seems like they've run through the filler. Why does that happen with certain individuals? And you see that often, right?
Yeah, we don't know specifically person to person with fillers. Some people just tend to metabolize it faster. Versus neuromodulators, where we do know that certain things can increase longevity or decrease longevity. So we always recommend, or I recommend, not working out for the first 24 hours because we know individuals who have high lactic acid levels can run through neuromodulators faster. Somebody who works out a lot, somebody who works out within the first 24 hours. We also know that, on the contrary, taking something like zinc, it's a supplement, can potentially increase the longevity of the neuromodulator. So we don't know as much about fillers and why somebody metabolizes quicker. We have a little bit more insight with neuromodulators. But what I will also tell you, what's interesting with fillers is if they're not put in the right area, for example, the right plane, under the eyes. If you're injecting in an area where there's no natural Hylenex or hyaluronidase, which we typically have in our skin, that product can essentially almost never break down. We have this natural enzyme in our skin that breaks down hyaluronic acid fillers. And that's what I use, man-made synthetic version, in my office if somebody's unhappy with their injectables, with their fillers. But if it's put in a place that it's not within that dermal layer where we have the natural hyaluronidase, that product can sit there for a long period of time.
Yeah. Wow. So sometimes when you inject fillers, I know that you go ahead and you take the approach of, look, I'll go ahead and use a cannula on this individual. Or instead of using the cannula, you'll go ahead and do various injections. What makes you decide one way or the other?
I tend to favor needle tip about 90% of the time because I like the precision. I like being able to see exactly where I'm putting it. When you treat with a needle, you're going obviously outside the skin into the skin. So I can see exactly where I'm injecting that product. When you're using a cannula, you're basically making a port site somewhere else. You're putting like essentially a little water hose under the skin, and then you're pushing the product through the syringe, through the cannula into the skin. So you don't have that visibility. Now, so when I'm doing contouring, when I'm doing lip enhancement, when I'm doing tear trough enhancement, I always use a needle tip. Where I tend to use a cannula is where I want more global volumization or I want global enhancement. So for example, when I use hyperdilute Radiesse to stimulate collagen and elastin, maybe along the cheek and jawline, I'm going to use a cannula. I'm going to do a fanning technique and lay that product throughout that whole area. It's much easier for the patient because if I had inject this large of an area with a needle tip, it's going to be a lot of swelling, bruising, and pain for the patient.
Sure.
But that is also a treatment where I don't necessarily need the precision that I would need, for example, with under eyes or lips, because that's more just a global laying of the product where I'll massage and make sure it intersperses evenly.
Yeah, so it's a matter of whether you want more coverage versus more precision.
Correct. For me, and there are a lot of providers who just use cannulas for everything or use needle tip for everything. It's a personal preference, but I like visibility, and I tell my patients, yes, you may have a slightly higher risk of getting a bruise or a little more swelling from the needle tip, or might be a touch more uncomfortable, but it's going to offer you a better result, a more predictable result. Thanks for joining us on Derm Talk. Next week's episode, we'll discuss why I started a skincare line.